And welcome to our June 10th virtual town hall meeting. This is in regards to our COVID response. We're very pleased to continue throughout this event with continual questions from our residents that have remained engaged, interested, and want to be informed on the pandemic that swept through our nation and our world many months ago. And I think, we've done very well. And so we continue to have these meetings. Next week will be the final virtual town hall meeting for everyone listening in today. And that will be followed up the following week with my annual address of the state of the city. So I hope all of our residents continue to participate as it's a great means for us to be responsive directly to our residents. I'd like to introduce our co-hosts, our weekly co-hosts again today. We have with us at our virtual City Hall, Bob Snyder, who is our our director of the Flagler County Health, or the Health Department of Flagler County. Welcome, Bob.
Thank you. Glad to be here, yes. Mayor Holland.
And then we have our city manager, Matt Morton. Welcome. And we have our Palm Coast Fire Chief, Jerry Forte. Welcome.
How are you?
Good, thank you. And then on the call with us, we're continuing to have such a great advisor in our medical director, Dr. Stephen Bickle. Welcome, Dr. Bickle.
Thank you.
And then we are very fortunate as well to have our Flagler County Emergency Management Director, Jonathan Lord, who really has, I joke about this last week, but I'm not sure if he has slept yet, but when he does, I'm sure it's going to be a refreshing moment for him, but has really been able to lead this response in partnership with a lot of the stakeholders in the community, and I think it's why we've done so well, frankly. So let's talk about that a little bit. Let's open up with an update from our health department.
Oh, thank you very much, Mayor Holland. Good afternoon, Palm Coast. Want to discuss with you briefly the three priorities of the Department of Health, which remains the same statewide, and that is testing and everything about testing. And folks, we're doing well. The goal was to test 4% of our Flagler County population by the end of June, and we are already closer to 6%. So far, we've received lab test results on 6,273 Flagler County residents, the majority of which reside in the city of Palm Coast. The second priority is the positive case investigation and contact tracing. That function is an epidemiological function performed by our public health nurses and disease investigators. And I'm happy to report that we are 100% on target, and we're able to do this in a timely fashion within 24 hours for the positive cases and get that contact tracing investigation going. Then the third priority in focus, as we've said before, is our nursing homes and our long-term care facilities, because that's where healthcare workers and the most vulnerable groups in our population reside. Healthcare workers and our senior citizens who are at risk with the chronic conditions. And so we have assessed and we announced the last couple of weeks that we're on a mission to test every single resident and staff in all 72 congregate care facilities in Flagler County. That task was accomplished about 2 weeks ago. I'm happy to report that of 1,550 folks that we tested, so far we've received test results back on 93% of them, and they have all tested negative. And again, that is a testament to our community, it's a testament to you, and especially to those very caring and compassionate healthcare workers in our nursing homes and our assisted living facilities, all 72 of them. So thank you all for paying such great attention to infection control and prevention best practices. This week, our staff at the health department, we tested 121 folks who would be regarded as homeless, disadvantaged. We visited every food pantry and distribution site in the county, including Santa Maria del Mar, United Methodist Church, Church on the Rock, the Hammock Community Center, to test anyone who wished to be tested. I know Jonathan's going to talk a little bit more about the community testing site still happening at the college. You know, and just final comments, this virus is going to be with us until a vaccine is broadly distributed and administered. And so as a community, we have to learn to live with the virus and do so in a smart and in a wise fashion. And so associated with that is what we call the gateway to opening criteria, and monitoring about 7 to 10 indicators that you're going to be hearing more and more about as time goes on. Indicators like, you know, how many positive cases do we have? Well, today we have 200 in Flagler County. 163 of the positive cases are from residents who live in Palm Coast. To already talked to you about, you know, testing. The goal is to test 2% of your population more and more as each month goes by, and so we are on target to do that. Total deaths have remained the same in Flagler County now for a couple of months at 4. We want to track number of nursing home residents that have a positive case, and so far that's 0. We only have 2 staff members who work in a long-term care facility that tested positive, and they've since been self-isolating, quarantined, and they're back at work. The number of emergency room visits associated with a flu-like illness or COVID-like illness, we track that daily, weekly. That's on a downward trend. That's stable. So again, these are all things that we're going to continue to look at and share with all of you, and it's information available on www.floridahealthcovid19.gov. And so again, the goal is look at those indicators, look at the data, what does it tell us, and then what's the current strategies do we have in place to continue to mitigate and keep these positive numbers low in Flagler County. You've heard us talk a lot about mask wearing. Well, this is indeed one of the strategies besides social distancing and besides the hand washing. The Department of Health received 67,000 cloth masks, facial coverings last week. We want to get all 67,000 distributed out there to you in the community. So I'm pleading with you, if you know of an organization or a group that is in need of masks and facial coverings, you call me directly at 386-313-7105. 386-313-7105, because we want to get these out to you. This is the most inexpensive, most effective, non-intrusive sacrifice that we can make on behalf of ourselves and especially our loved ones, the people that we care about, our family, our neighbors, our friends, our children, our parents, our grandparents. Mask wearing, I have 67,000 that we need to give to you. Please call me. Thank you.
And with that, we really appreciate that update, and we really, again, want to recognize and thank our residents for really, truly being a partner in this exercise. They have stepped up in an extraordinary way and have been very compliant with everything that's been asked of them. So let's continue to join together in this moment and be, continue to drive those numbers down as the economy opens back up and keep those most vulnerable safe.
Absolutely, Mayor. Thank you.
And so, Jonathan, with that said, if a couple things I think if you could update the community on. One is anything response to COVID-19. The testing we certainly want to hear about, as well as I know hurricane season is upon us. Another role you're currently wearing, a dual role, is making sure that our community is adequately prepared and ready to respond if a hurricane hits our community. So if you would just also give an update on that, that would be greatly appreciated.
Sure. Thank you, Mayor. So let me first talk about the testing. So we're doing ongoing testing at the Daytona State College Palm Coast campus, and that we do encourage people that want to get tested to call 4200 during normal business hours to make an appointment. We are set up to do up to 150 tests a day there. Our demand recently has been more likely between 50 and 75 per day, but we can do double that. So we really can handle up to 150, and we do want any Flagler County resident or worker, so even if you live in another county but you work here in Flagler County, to call the 313-4200 number and make an appointment for Tuesday, Wednesday, or Thursday. We really want to get those that are either experiencing any of the COVID-19 symptoms, which are basically the same symptoms you have for a cold or the flu, have experienced those symptoms anytime in the recent last month or so, to call and go ahead and get an appointment. Also, if you have been exposed directly to somebody who's had COVID-19, please go ahead and get tested. We're going to continue to offer that service until we're consistently below the community demand of 50 a day. And then at that point in time, I believe Bob's capable team over at the health department could probably easily handle that lower volume. But I want to keep doing it until we're seeing below 50 a day. And I want those to not hesitate who want to get tested, just to give us a call and get an appointment and come get tested. Again, we're doing that on Tuesday, Wednesday, and Thursdays. So let me talk a little bit about the testing site, because I really want to acknowledge the partnership that's happening out there. So the testing site is actually overseen by Flagler County, and actually in particular, a woman by the name of Karen Prather, who is our countywide community paramedic. She is basically, as we in our world call, the incident commander. She is running that site with logistical support from a whole host of volunteers. So volunteers that live here in Flagler County are helping do the logistics of setting up the site and doing the traffic flow. We also have paramedics there that will actually doing the testing from Flagler County Fire Rescue and Palm Coast Fire Rescue. And then we also have our partners with the health department helping us ship off the labs and getting it tested at Quest Laboratory Company. And the state of Florida is actually picking up the cost for the test at this point in time. So it's an amazing community-based partnership with so many players. And a few months ago, or a month or so ago, we also had Advent Health as part of that partnership too. And even though they're not directly involved in testing now, they have covered the cost of the tents and things that we have out at that site. And then we are now shifting, the county is now picking up the cost of that. So Advent help minimize some of those expenses out there as well. And we've had a couple of the lab companies like Diagnostic Solutions, which was a local company that helped do some of those tests under contract with the county until the state picked up those costs. So it is just an amazing partnership that in a community our size, we don't necessarily have multiple healthcare systems that in other counties that would then do the testing on their own as the private sector would. So because of that, we had to come up with a unique solution that is really not mirrored anywhere else in the state of Florida. Some of the other smaller counties, it's only on the health department, like Putnam, I believe the health department's doing it. Little pop-up ones all around Putnam County. We just have this amazing partnership here that I'm just so proud of. I think all of our residents should be so proud of. That was just this amazing team effort to make this occur, and I'm so excited about it. Hopefully you can hear that in my voice. And we're gonna keep doing that up until we just see that demand drop. But I don't want the demand to drop. I want people to get tested, just like our health director has mentioned. We want folks to get tested and so we understand what COVID-19 looks like in our community. As you'll all see in the news, Florida is starting to see some pretty decent spikes in positive COVID-19 cases. That is not the end of the world. It's just, I think it's very much a symptom of the fact that we're doing more and more testing statewide. And yeah, and there are more people sick, and we've gained 5 people in the last day or two here in our county. Again, 5's not a ton, but still it's 5 more people. But the key indicator that I know Bob has previously mentioned on this is really about the impact on the healthcare system. So not necessarily the number of positive cases, it's the number of truly sick people who are seeking healthcare. And here in our community, that is not having a hugely detrimental impact on our healthcare system. So it's just understanding the spread of the disease in our community. But also, when you look at our county, I don't know what the amazing bubble is. I think it's because I attribute a lot of it to the consistency of cloth face cover wearing in our community and people taking it seriously. Is our growth rate is so much less than the overwhelming majority of the state of Florida in testing, yet our testing rate is actually higher than many other communities in Florida when you look at the percentage of population. So higher testing with lower percent of positive cases means something is being done right in our community. And our residents and our businesses and our governments, I think, kudos to all of those players that are a part of just helping keep the spread down. And let's keep it that way until this disease vanishes. I think it would be an amazing thing. And then just to briefly shift topics over to hurricane season. I know we talked about it a little bit more in detail last week. But yeah, so hurricane season, again, for those who didn't hear this town hall last week, COVID-19 does have an impact on our hurricane sheltering process. But I definitely want to have our residents rest assured that with our sheltering partners, that we do have plans and equipment and masks and stuff in place to help protect our residents as best as possible in our shelters. So don't let the fear of COVID-19 steer you away from evacuating if your evacuation zone is called to evacuate. If your evacuation zone or your type of structure, like a mobile home, is not told to evacuate, then please feel free to hunker down in your home or with friends or family members that are in areas that are not evacuation zones. And I know many of you rely on hotel reservations in neighboring counties, our county, or even Orlando that has thousands upon tens of thousands of hotel rooms. Feel free to keep that, if that's your plan and you have the means to do so. Please continue to do that. Shelters aren't the most comfortable environment in the world, but we will always make sure that we can put a solid roof and 4 walls and feed our residents in a safe building as the storm passes over. And all of our partners are engaged and ready to do that. So those are our big things. And again, if you haven't already built your disaster kit, while you may have missed the sales tax holiday, don't let that deter you from shopping. Please shop locally in our stores here in Flagler County and make sure you have that disaster kit for hurricane season and throughout the entire year. And then also our disaster preparedness guides. I know the Palm Coast Fire Department is working on something in July to help get some of those out to our community. And they usually do it earlier in the year, but COVID-19 unfortunately put a little pause on that. But we have worked with every single grocery store in Flagler County, and they've all been provided guides, and they should be readily available in all of our grocery stores as well. And if any other group or organization wants guides, we can get guides out to you all. So thank you, Mayor.
Thank you so much, and thank you for your leadership throughout this, Jonathan. Very impressive, and it's certainly helped us throughout this process, so we really appreciate it. And the partnerships, frankly. We could not do that, as you stated, without the partnerships. So Chief Forte, I know we're going to open up with a few questions, but I thought it was important, a couple things. We've gone through the governor's reopening strategy. I know he last week went into an additional phase that allowed different businesses to open up. So I would ask that you sort of give, from the city's perspective, that reopening strategy, where we are with others, and then Matt, if you want to tackle on any additional information in regards to, just city services, those sorts of things that may be important.
Thank you, Mayor. And I had an opportunity to go back and look at all of the notes and the emails and the direction that we've started late February, early March, when this pandemic really began, and looking at the uncertainty that everybody had going into this, and seeing the direction from the governor, the governor's task force, the Department of Health, the CDC, our partnership with Jonathan Lord and the emergency management. It is, looking back, it was very scary because we just didn't know how bad was going to be. And now we're at a point where we avoided the main brunt of the pandemic. We didn't see the devastation in casualties that we were anticipating, luckily. And now we're at the point where we are recovering. We're in that phase of coming back from what would have been a very terrible period. We isolated for 2.5 months. We created new culture for ourselves. We learned to distance ourselves from relationships, families, organizations, people. And now we're starting to assimilate back into a new society of what it is that we're willing to accept for our future. All of those things coming into account is going to play out over the next several months. And Captain Asconi made a point this morning of pointing it out, is this is still prevalent in the community. It's still out there. Jonathan just said we had 5 more this week. There are senior living centers that are still having it in other counties. It's still prevalent. We have to still be cognizant of what's happening in the future and still take those precautions. Even though we're out in phase 2 doing more personally, there are still people that are going to be affected by this if we allow it. there's a strong possibility, and I hope Dr. Bickle or Mr. Snyder can chime in, but there could be a resurgence back in August, September, when the weather starts to cool down a little bit and people start gathering more for schools and churches and things like that. So please be cognizant of, we are just starting to see the sunlight. We are not in a condition to celebrate or rejoice yet. We still have to take the time and be dedicated to the task at hand, and that's still isolation, mask, social distancing. But the governor's task force is telling us we can start doing more things in groups, and if we start seeing a resurgence because of those gatherings, we might be putting a pause on going into phase 3. That has to be an important detail that everybody understands. For the city, as we open, we look at our city partners and how they're going to open up the city. We're looking at a June 15th re-entry of employees. That gives them the opportunity to come back, go through the cycle of what a work week would look like. We can analyze what our personal protective equipment would be for the employees, look at the way that people would come in as the public and get services. They would walk through the building, start to experience what the normal work week would like, and that would take the bugs out, for example, of what it would like to have to run the city once we open it up. We are looking at the week of July 7th, introducing the public to City Hall, getting folks back into the system. And one of the best things that we've done is we took the how would you do it out of the system. 3 months ago, we never thought we would go completely automated for permitting and things like that. We have done so much work while people weren't in the building that most people were able to completely keep functioning in their capacity. So while we start to experience what we're going to do opening up on June 15th, that'll give us 2 weeks to get the system in place, make sure the processes are in place, and the employees are centered in the building and they're comfortable with what we're doing. We have to also keep in mind that we have employees that fall into that vulnerable age group or that vulnerable health group that we might have to make conditions for. We will know that once they come back and we start to work people into the system. There are designs out there on how to work with the system and the public. We've studied some of them. I think by the time we open on July 7th, formally in the public, we'll be in a good place. But right now, we're going to bring people back on June 15th and start that process internally with employees. The fire department has done something that we haven't done in years. We've kept ourselves from going out in the public. And since we've entered phase 2, now we're at the point where we can start opening things up again. So we're going to start multi-company training. So the crews have been working together and training individually, but now we're going to start doing more training with the other stations in our zones so that they can actually work as a group doing higher level training. We begin shift meetings where the deputy chief and I will go out every Thursday and meet with one crew, and we've been doing that for a long time, and we're going to get back into meeting with the department staff again, doing that. Specialized training will start in July. This was difficult because we were working in very tight groups, and with the social distancing, we were trying to limit that. We've tasked the commanding staff and the people overseeing the training that now they have to come up with techniques on how we can work as a group, and then starting in July, that specialized training in confined space and rope rescue is going to start to work again. We're looking at developing the plans to start CPR programs and get back into the home safety program practices again, where we would go out and help seniors with their smoke detectors and the battery changes. This is critical for the seniors that don't have to climb ladders to change the smoke detectors. We do it for them. So we're developing plans internally so that when we go out, we're protecting the public when we go out and see them. We're looking forward to what happens in phase 3, but for phase 2, we're starting to branch out and do what we're needing to do.
Thank you for that. And again, thank you for your continued leadership as well. And just one last thing to note, you were very pleased to announce the drought index as of this morning. Did you want to share that news with the public?
The drought index is 0.1. 1 is the index, which is a relief. both for me and the other fire chiefs in the county, that we have one less thing that we have to worry about. And if Jonathan can keep the hurricanes from coming, that would really be great.
Trying my best.
That's fantastic news for all of us. And Matt, did you want to add anything? Because I know you've been an integral part of consulting with not only Chief Forte, but Captain Asconi every day as far as the reopening strategy, what that means internally, what that means externally,
Yes.
how we interact with the public safely on both sides. So would you like to give an update there?
I will, and I'll stay out of a wonderful job on the pragmatic side and all the work that's been done. So I'll be a little more factual just to get some solid information out. So as the chief mentioned, we have a target for a soft opening of City Hall on July 6th. It will be different. I want to reiterate and be very clear that we will be requiring masks. We will have some masks here to give to the public. I might be asking the health department for some more masks to distribute those on behalf of the community. We will be requiring a temperature check. It's very quick. It's non-intrusive. It's non-invasive. It's just a simple scan they'll do at your forehead. It literally takes a second or so. You will be answering some health questionnaires. Just 3 simple questions about have you been in contact, are you feeling ill, or have you been around someone with COVID or flu-like symptoms. Then once you get inside the building, we will be using the occupancy guidelines of groups no greater than 50. That's never been a challenge at City Hall with the flow that we've had in the past. But you will see a lot of markers on the floor and guides and helpers to make sure that we're socially distancing, that we're queuing up properly and waiting. But we're also tackling those strategies not to create another line or a queue mentality, but rather to make sure we're as quickly and efficiently as possible, as we always try to be, in helping people get their business done as they see the need to do it, and getting those things accomplished. Similarly, on Tuesday of that week, July 7th, we will resume with our first in-person city council meeting since the outbreak of COVID-19, and the same criteria are going to apply. We will have a mask requirement. There will be a temperature check and health questionnaire, 3 simple question station. It will be limited to no more than 50 people, and out of respect for that, we will continue for the time being to have most of our staff Zoom in to the meetings as we have to provide a space for our public to come in, because we will have to cap the meeting at 50 people. So that's all looking good. I am happy to report too on the practical reopening strategy. The first weekend at Indian Trails Sports Complex went extraordinarily well, and so just my gratefulness and gratitude. Thank you to particularly Palm Coast Little League, but the other groups that used the field and the citizens that went back out and used the facilities. Fantastic. Thank you so much for working with us to make these transitions smooth, make them work well, and know that we can, again, continue to sustain that level of excellence with our partners, with our stakeholders, with our citizens, to keep these facilities open and smoothly operating through the rest of this pandemic. You said whatever it looks like, and preparing that we're ready just in case something does happen in the fall. But I do want to mention that the transition to virtual between Palm Coast Connect and our virtual City Hall has and continues to be just absolutely tremendous. The chief mentioned it, Mayor, I think you mentioned it. There is almost no business service that's been interrupted to any extent. Those that have been interrupted, we chose to interrupt. We chose to stop utility cutoffs, again, in partnership with our residents. We chose to suspend code enforcement for a period of time while we were going through this, large extent of it, other than specific health, life, safety. So those services will resume, but for the long term, we're going to still encourage in this phase, and it is in this phase, telework. So when we say we're going to reintroduce staff, we will not be fully staffed back up at City Hall, but rather key personnel or rotational shifting. So we're going to continue to encourage and ask, keep using the tools that we've created. They're fantastic. Palm Coast Connect, the case log, the case management, the amount of information that you can provide, our virtual City Hall services, again, tremendously successful. And then another big change that is permanent, because of the value, is our communications strategy here at the city. And as some of our residents have noticed, and I've gotten some questions, why did the fire department or the Parks and Rec or other pages migrate? And what we have found, and the facts bear it out, is people need a central source. We call it the single source of information, or single source of truth is what we're calling it here internally, where you can go and get all the factual information, relevant updates for the city, the current, and good information that the city is putting out in one spot. So that will be another permanent change I want people to be aware of. that we have worked very strategically with our fire department, with our parks department, and with other entities that would normally use social media communications tools. And there will be a single place you can go to find those relevant updates, track those areas of interest you have, so we can do a better job long-term of communicating with our residents. And I'm grateful, Chief, to your communication staff, to our parks communication staff. Change is always hard, but everyone has seen the value of that change and how much more of a significant audience we have, how much more clear we are told our communications are to our residents, and how much more easily they're able to find things that they want to know, need to know, or that matter to them. So that will be another long-term change. Beside that, we'll continue to work with our partners for the foreseeable future and monitor the phased approach. And lastly, there might be some little changes that occur in reopening, and I think Jerry sort of touched on it, but our direction has been make sure we're taking the right opportunities as they come along. So how can we continue to serve our community better, and what does that mean? And so we're looking at maybe having extended hours on certain days of the week till 6 p.m. for our shut-off clients, or different things, so we can be responsive, stay within the criteria, and just do a better job overall. So I think we're headed in that direction, and we'll continue to monitor and work with our partners.
Right. Thank you. I think we'll go into the Q&A portion of our town hall. Again, really thank you to our residents who continue to put forth some really important questions for the benefit of the remainder of our residents. So since we just really highlighted a little bit more of the reopening, I really just want to focus somewhat on masks. There were several questions that came in regards to masks. It certainly is a hot topic, one that I know Dr. Bickle and Bob, you have been following and tracking. So do you want to sort of go through the 4 questions and sort of pose them to you and Dr. Bickle or Jonathan or whomever on the panel you think is appropriate?
Yeah, why don't I go ahead and start, and then Jonathan and Steve will pass the baton on to you. One question here is, there's no statewide requirement for wearing of masks by healthcare and diagnostic testing facilities, and that this individual said they've only found really one healthcare facility in Palm Coast that requires everyone to wear masks. Well, I personally have been to the hospital recently and been to a doctor's office, and so my impression is that healthcare workers in our community, they are doing the right thing. They are making it mandatory that their staff and their healthcare systems wear masks and do the temperature checks and the social distancing, see that happening. We don't know that for sure, that all 100% of healthcare facilities and workers are doing that, and it's not mandatory, from the standpoint of a governor's executive order or anything like that. However, it is so strongly recommended, especially healthcare workers who are at high risk, and then, of course, the elderly that we've talked about here before. But anyway, Jonathan and Steve, the other questions are just about, should we mandate it? Does it make sense for local retail stores, for restaurants, food service workers to be wearing masks? Can you both address that, maybe starting first with Dr. Bickle and then Jonathan? So let's talk about mask wearing in these different kinds of settings here in Flagler County.
Me, Dr. Bickle?
Steve, yep.
Okay. Yeah, it's unfortunate that this controversy has sort of developed about masks, and I think, I'm not quite sure what to make out of all of it, but I think part of it is there was some initial confusion about the mechanism of transmission of COVID, because there's this droplet versus aerosol issue, which it complicates it. And then maybe more importantly is this issue that many people with who are highly contagious in the early days of their illness are asymptomatic. And so because of that, you can't count on people quarantining themselves because they're sick at home and then not being around out in the community infecting other people. And that's had a lot to do with the worldwide transmission of COVID. And that's kind of changed the game with masks. And I think, it's almost counterintuitive. People think, well, I'm wearing a mask to protect myself, but maybe that's partly true, but really you're wearing a mask as part of a group that's protecting each other. And I think the other issue with masks is, we value our freedoms. I'd like to see virtually 100% use of masks in all indoor settings. The thing that has been presented to the public is that there's this trade-off between sort of, these devastating economic impacts from shutting things down, and then these potentially devastating health impacts from the hospitals being overloaded with people seriously ill. And what we're trying to do is pick the measures that allow us to maintain the economy and maintain people's health at the same time. And there only really are a few like that. So that's why it's such a big deal. The people who are sort of skeptical, I'm just saying, it's like, we don't want to shut businesses down. We want people to be able to resume their activities. So the big ones are the ones you keep mentioning, Bob keeps mentioning. One is close to universal mask use indoors. Secondly is super aggressive public health contact tracing, identifying these cases and then isolating them, and like we do with any sort of epidemic. Those two things have minimal impact on the community. And that's why they're highly effective. Those two things alone, if done right, can pretty much keep this from spreading. I mean, it doesn't mean it won't be around, it means it won't grow. And to me, that's such a major accomplishment. I'd really love it if Flagler County and Palm Coast could accomplish that for ourselves. So it's kind of a philosophical point that I think it's something that really could allow us to get back our lives and our economy and keep people healthy at the same time.
And Jonathan, I know that you have strong feelings about mask wearing as well. I think it's worth repeating.
Yeah, I think just building on what Dr. Bickle said, I kind of like the way he ended his statement there, is if people could just take it upon themselves. It's such a simple thing to do to cover your face, cover your nose and your mouth with a cloth covering. You're wearing a shirt anyway, just throwing a cloth covering in your pocket, or even if it's a scarf, anything, even another shirt or something like that, just over your mouth when you're around other people, particularly indoors. It's so unintrusive. It's something that in theory costs almost nothing. You just mentioned you have 60-some thousand of them.
Yes, we do.
If someone can't afford one, then just reach out and the health department will get you one or two or three. So, I mean, it's such a simple thing that we can all do for the greater good of mankind that it doesn't make sense not to do that when you're around other people. If you're like me, I'm sitting in my office alone right now. I don't have it on because I'm by myself. But when other people are around, I put it on. And I think it's, again, simple thing to do. It's easy. It's so unintrusive, and that it does make a difference. Again, our community seems to have a lower growth rate of positive cases, yet a higher percentage of testing than many other communities. So we are doing something right here, and I think a big part of that is people are doing what they can to socially distance and putting on masks when they can't socially distance.
And this argument about, I'm anti-government, I really, my liberties are more important to me, you can't tell me what to do. We hear that in the media, we hear it in social media, and I just got to remind everyone, this is an unprecedented public health crisis that we haven't seen in 102 years. And the science and the evidence and research does tell us, and the public health professionals nationally and statewide level and here locally, you're hearing it loud and clear. Mask wearing is the way to go. This is how we're going to protect each other and protect our loved ones, especially the most vulnerable, from getting the virus. So please, jump on the bandwagon. This is an issue about safety and health of all of us, as Jonathan and Steve just mentioned.
And I would like to point out, I think that's where we have control over our sort of the government facilities. I know the county has taken this very seriously as well, has put in place the precautions as they reopen county buildings. I know the clerk of court had made an announcement upon reopening that masks are required there, as well as the other constitutional officers that, again, we have sort of like the ability to make that determination and recommendation. It is not a requirement, and we do hear that a lot about businesses and them, residents being afraid to walk into a business that doesn't have, their employees wearing masks. And so I think that's that, direction that we're getting as well, is if all of us come together as a community and really take on this challenge in this moment, we're going to get through this together with the numbers low. And so I do think that's important. And before I go into sort of the other reopening strategies about that, I'd like to hear both from Bob and Dr. Bickle about this discussion about the resurgence of this and where we are, what you guys are hearing about this. And we're obviously prepared for anything that comes with our stakeholders and teams that go through these exercises. But what are you hearing, in your discussions, in your dialogue, not only here locally, with your peers throughout the state, with your peers throughout the country, and globally? What are you hearing? What are you reading? Has it changed? Has it shifted? What do you think?
Well, we are going to be paying a lot of attention, Mayor, over the next couple of months, Dr. Bickle, myself, and our team, and Jonathan and everyone, on watching those 7 to 10 indicators that we're going to let you know. We're going to let all of you know in Palm Coast and in the community if any of these indicators kind of head in the wrong direction, so that locally strategies can be reassessed. And I'm sure that's going to happen statewide also. Just know it. So that positivity rate for new cases over the last 14-day period, that's one of the indicators that we look at daily. And it is slightly less than 1% for Flagler County, as well as all the other indicators. So that's number one. We're going to be watching that to let you all know so that we can then readdress and maybe redirect strategies accordingly. Now, Dr. Bickle, we've talked a lot about this, about a resurgence in the fall. The data will tell us for sure if we're heading in the wrong direction and trending upward. What are your thoughts about that? We're hearing a lot that there probably will be a second wave.
Yeah, this is a tough one. A lot of the research that relates to this is looking at what they call the effective R's, the effective sort of spread rate, and it's at the level of 1. The disease continues at sort of its same level in the community. It doesn't die down, it doesn't expand. A level below 1, it dies down. And a level above 1, it expands. So in Florida, for instance, it's gone from 0.8 to about 1.0 in the last 3 weeks, roughly 3 weeks. That means that we've gone from diminishing the numbers to kind of leveling off of these numbers. And we're just starting to open up. So people don't realize this opening up, that we've gone through historic social restrictions. This lockdown is unprecedented. And now we're coming out of it. This is a very contagious virus. And it's just kind of expected. It works with a lag. It takes a while for these numbers to really grow. But it's out there waiting. And so I expect they've looked around the world. They've looked at this in Europe. They've looked at this in other countries. It is a real battle when you start opening up. And that's why we keep, pounding the table on masks and contact tracing and doing everything we can to fight this when we open it up, because the last thing we want to do is to have to lock down again. And it is a real threat. It's very hard to predict, but there are countries around the world already now, like France. Their R is 1.4 from opening up. Well, that 1.4 is pretty, it doesn't take long to really expand. So if you expand from a low number, then it takes a while for that number to be really high. But we're expanding in Florida if we do expand from a higher number than in Europe. So we don't have a lot of room for error here. So it's very hard to predict, but I'm very concerned. And what I'm hoping we can do, especially in our county, is be as aggressive as we can with the measures that aren't so intrusive to keep this in check.
And past viruses, the SARS virus, H1N1, the 1918 Spanish flu, all showed that when you increase mobility and as you reopen things up, that's where things have the potential of going in the wrong direction. And 12 states in the nation are already experiencing that as they've opened up after Memorial Day, and people are concerned about protests. So again, the point is we got to learn how to live with this smartly and wisely, and just do the right thing, i.e. like the mask wearing.
So let's switch gears with a question that was posed. I'm going to give this to Matt or to our chief as well. Why do residents of Orange County get help with rent, utilities, et cetera? They announced on TV they just received $146 million to help their residents from the government. Where is our help? Do you want to take that?
Absolutely, thank you. So, to start out, the first stimulus package that came, known as the CARES Act, unfortunately, the city of Palm Coast did not qualify. So we did not receive that federal stimulus money that counties with a population over 500,000 people received. So our neighbors to the south received that money, and the county and the cities received millions of dollars for this very type of endeavor. However, we're not stopping there. So we did work proactively with the Community Development Block Grant Program, and we will have, effective in July, it looks like we're going to be able to allocate about $100,000 towards helping the LMI, which is low to moderate income, as defined by federal law, pay for utility bills for the coming months. So there's a strategy we've adopted and again, tried to move proactively to help our community. Similarly, the city, as part of its annual budget process, granted money to human services agencies in Flagler County for the express purpose of utility bill assistance. We have completed that, and those funds are available through, you can contact through Palm Coast Connect or our customer service department, and they can get you in touch with those granting agencies. So we've tried to help along that line. Similarly, as well, we've been working with our local faith-based and human services groups to try to coordinate and provide further utility bill assistance. We've been working with our lobbying group and in coordination strongly with Flagler County and their lobbying group, because there is still excess money available in the first round of CARES funding that I believe the state of Florida has at this point in time. They are in a holding pattern at this moment, waiting to see the impact on the state budget. There is an allocation formula that they have, my understanding is preliminarily developed to transmit some of that CARES Act funding to the municipalities and counties that didn't reach that initial population target. And we are asking that question and trying to get some of those appropriations for our community and for Flagler County and our residents. And then the last thing we've continued to do is we do not have, as the public's aware, any utility shutoffs. We've had no late fees or penalties. That's a measure we've taken. We will continue to not have late fees or penalties for a while. As we move into the phases, at some point, we will be back to shutoffs. But for now, we've taken a very proactive approach and not just relied on the fact that we were told no in the first act of CARES funding, and continue to work several strategies to assist our community and our residents, specifically with utility bills.
Thank you. And I'm sure that's going to help and go a long way for our residents that are struggling throughout this pandemic as well. Another question in regards to the reopening. You touched on sort of where we are with phase 2. Can you speak to summer camps? You spoke briefly about the use of Indian Trail Sports Complex, and really focus on the community center. I know we've gotten a lot of questions around programs. Our city offers a lot of programs over at our community center on a daily basis, and I know your strategy has been with our Parks and Rec department to focus on, how do you safely allow multi-generational individuals to utilize the facility in a way that's going to be measured and monitored, and so if you can speak to that first one, I think that would be helpful.
Sure, and I think Chief Forte may have a point in that too. So effective the 15th, so just in a few days, we will have camps beginning to resume, and that was a very coordinated strategy with Flagler County School Districts, that we all could come together and say we were ready, we had a regional supply chain, we felt comfortable, to some of their discussions that the medical factors were tracking correctly, that we could bring, kids back to camps in the community center. Now, one of the larger challenges we're still working with, again, resource allocation challenges, is the guidance is still there from the CDC. It's still there from, I believe, we talked about this last week, Bob, from the health department about those especially vulnerable populations that we statistically seeing being age 65 and older. We still have to distance the groups for summer camp, so we're breaking what would normally be larger groups in a larger room into several smaller rooms. We really need that time strategically, is similar like we're doing with City Hall, to get some people back in the building, to get our employees back in the building, to get families back to, and people driving and parking and going through the parking lot at the community center and opening doors and all those things, to know that we have our protocols proper, that we have the right response. As of this morning on our morning team city strategy call, we're still waiting for the last reliable pieces of supply chain to come in for the City Hall opening. And we believe we're going to be fine for that July date, but we need that reliable supply chain as well for our community center. We are finalizing our room-wide sterilization programs. What does that look like? And then the conversations have been likely, if we can dedicate a room, a specific room for our seniors to start coming back to, that we know will be more aggressively, even as our already aggressive cleaning schedule, routinely sanitized and sterilized and cleaned, and be able to, again, respect our residents by opening properly with the right measures. And that's what we're working on at this moment. We understand, and we get those questions, a lot of questions about a desire to return back to the social activities. To your point, Mayor, we've had, I think, a great level of success and got wonderful feedback about our virtual programs, because they weren't just static virtual programs. They were interactive. We had several contests. We had online virtual events where everyone could participate at the same time. But we're working very, very confidently, and again, with very specific steps to get it back open to the greater number of the public.
I just like to add one aspect is the decision to go into phase 2 was a big predictor, because up until then we could only put 10 people in a room. That includes little people. So when you start putting the children into a daycare or a summer camp, we are actually limited to what we can actually do. We also didn't have a lot of information. We are learning as we're going. So when the question came up as, can they go play on the playgrounds in the swing sets, and how do you decontaminate those? There was no written rules for those, and nothing had come out at that point. So when they opened up phase 2 and the governor did allow up to 50 people, that gave Lauren Johnston and her team at the Parks and Recs Department the ability to see the bigger picture and what they can do more feasibly. And it puts the folks that are actually wanting to do all the daycares and the summer camps back into the field that they feel comfortable with, and that's large-scale scheduling of people. Initially, we were looking at, if we had to bring employees back, opening up summer camp to some extent, and then open it up to the public. Now they've got more latitude to do that because of the direction that we're getting from the governor with the opening of the phases. And now we've done more research on disinfecting and cleaning. So we feel more comfortable now that we're ready for that June 15th start and allow everybody to come back and slowly make those migrations.
And another question that is an interesting one. I mean, I think it's just asking for a piece of advice. It literally is. Would you be able to offer any advice regarding procedures to follow when you have people coming to the house to conduct service calls or installations inside your house? Are we allowed to ask people to wash or sanitize their hands? Are we allowed to ask them to wear a mask?
Yeah, it's your home.
Your house.
Yeah, it's your home.
That is your last bastion of safety and security. You should feel comfortable. If you want somebody to come in and earn money from you to do a service, there should be some criteria that they have to understand that when they come in.
And
I would say a good company has already got those things thought out. They've already presented those things with their employees, and they have an understanding. But certainly if you fall into that vulnerable criteria, or you have health issues, or you just have recent health issues that you've got pronounced with, you set the tone for the people that come into your home. It's as simple as that.
I found myself listening to WNZF a lot in the car. David Ayers, thank you for the information he does put out. But Well, the point of that is, you hear it every day on the radio, that I think businesses are understanding and embracing, and I hear all the time, we have those no contact strategies, or we have masks, or I had to call a service to my house the other day, mask, they had the booties, and I was very grateful that they're respectful of that moment, and it's very appropriate, as the fire chief said, to ask those questions and ask for that consideration.
Yeah,
Absolutely.
and thank you for that question, because it is an important one, and we do still have, a level of concern that, we're trying to advise as best we can. So we talked about sort of the public meetings. Jonathan, since, we have, listeners here, and this is being live streamed on WNZF as well, so thank you for the reminder. But Jonathan, as far as the county building goes, I know you had reopened. I saw how you guys are taking the temperatures, mask wearing, those sorts of things. Can you speak to sort of like the county meetings? What's the strategy there, just so we can get that information out for our residents that want to participate as well?
Yeah, so we are going to be opening up our county meetings. Our next commission meeting is next Monday evening, at 5, off the top of my head. And we have a large commission chamber, just like the city does, but at the same token, even large rooms are limited to 50 people. So we're going to have have attendee restrictions, so no more than 50 folks in the room, as well as requiring masks, and we'll be doing temperature screenings for the commission meetings, just like we're doing now. If you come to one of the county facilities now, and whether it's one of the constitutional officers, like the tax collector, or you're visiting a county department, as you arrive at the county building, you'll be asked to wear a mask, and if you don't have one, we'll make sure we can get you one, and you'll have your temperature taken. And if for any reason you are unable to enter the building because you have a temperature or something else, we will make sure we find a way to offer you that same service, and to just ask you to wait there, and then we'll find someone or get you on a phone call with someone to make sure we can offer you that same service. So we're not looking to restrict anyone's access. We'll just work around whatever restrictions may be in place for you personally, and make sure you can get the government service that you do need.
Thank you for that. So speaking of that phase 3, when do you think, I know the governor, it's down to, 50 people now. Has there been any discussions about larger groups? I know that's full phase 3, or is that monitored or measured as well in that process?
Bob?
Yeah, I haven't heard much recently, at least from the state surgeon general.
Okay.
Department of Health is part of the executive branch, reports to the governor, and no, I haven't heard any recent chatter or talk about beyond phase 2. Have you, Jerry?
No, I would imagine that they're going to monitor what has been opened and
Yeah.
allow that 2-week cycle to take place.
Right.
They just went to 50 in a group, and let that take in and see how that works. And if they go 2-3 weeks, and they'll monitor and see what the numbers are at that point before they consider fully opening.
I know there's 2 things that the Surgeon General is looking at very carefully. The positivity rate over the last 14 days of new cases, which we've mentioned, we shared that here. And number 2, just making sure that our hospitals are okay, that there's not this surge of hospital admissions related to COVID-19 or emergency room visits or ICU bed usage increase. I know that is always paramount in our mind statewide. So they're going to be looking at that very, very carefully.
Jonathan, did you have something to add?
Yeah, and we may see increases in occupancy capacity or building capacity, the amount of people in a room, occur within phase 2 as well. So we saw that with phase 1 with a couple of jumps. So we may see, instead of jumping all the way to phase 3, we just may see some loosening within another part of phase 2 as well. So I think everything is still a possibility to see it happen in that fashion.
That's a good point, because it was only, less than a week ago where the phase 2 with the reopening of the bars and the other facilities that the governor announced,
The
correct?
tattoo parlors and the massage
Bowling
parlors,
alleys
correct.
and other service, correct.
And so that still remains indoor with the 50%, is that my understanding?
I think massage parlors are okay by appointment only, tattoo parlors are fine, correct, yeah.
Okay. Yeah, that's a good point, Jonathan. And I think it's why, we continue to make the decisions we're making correctly is under the federal and the state guidelines. We have been following them from the beginning, but making sure we're safely reopening our facilities as best we can. So I think the message has been very clear today. We are out of time. But, I really want to continue to thank you for participating and acknowledging the significance of this moment in our community. You truly have been extraordinary, and it's helped. It really has. It's gone a long way. So let's continue to do our part, continue to follow all of the recommendations as a way to get through this even more together. So thank you, and have a great week.